Before toothbrushes, before anesthesia, humans still fought one of the oldest enemies, tooth pain. From sharp stones to bronze chisels, the story of dentistry begins thousands of years ago. People knew a deep, sharp pain. Tooth pain is old. It is as old as people. It is a universal language spoken in groans and winces across the millennia. This constant, throbbing ache has been a companion to humanity, a silent torment that demanded a response. Humans have fought this relentless pain for a very, very long time. This is the story of how we learn to face it, a journey that begins not in a sterile clinic, but in the dim light of a prehistoric cave. It is a story of small tools, brave hands, desperate measures, from sharpened stones to gleaming steel. Long ago, people used simple tools for every task, including fixing a painful tooth. They used what nature provided: sharp stones flaked to a fine edge, pointed shells, small splintered pieces of bone. These objects could scrape, probe aching holes, and reach into dark corners. Often they hurt as much as they helped, causing new injuries or infections. People tried to remove rotten teeth with brute force. They tried rudimentary ways to stop infection. No clean tools, no medicine to stop the blinding pain. Still, they worked at the tooth, driven by relief. Archaeologists have discovered dental work dating back to 7000 BCE. In ancient Egypt, physicians treated gum disease, while in Mesopotamia, people blamed toothworms for their pain. The story of dentistry begins long before cities, long before writing. It starts in the quiet of the Stone Age. Pain was a constant teacher. A broken tooth could mean infection, starvation, death. Early humans had to find ways to cope. The evidence is not in books, but etched into bones and teeth. The earliest attempts weren't about fixing teeth, but enduring pain or removing the source entirely. A loose, painful tooth might be knocked out with a rock. Neolithic archaeological finds reveal something more sophisticated. In a Pakistani graveyard from 7000 BC, researchers found molars with drilled holes, too precise to be accidental, made by a skilled person using a flint-tipped drill. Purpose: relieve the pressure of an abscess, remove decaying tissue from inside the tooth. One of the earliest known forms of dentistry, not just violence in an attempt at treatment. A move from extraction to restoration. Applying it to dentistry was genius. In Mesopotamia, in the Fertile Crescent, people told stories to explain a toothache. They didn't know about bacteria or decay like we do. Instead, they believed a tiny malevolent worm lived deep in the tooth. They called it the tooth worm. They recited incantations and spells. They burned seeds and inhaled the smoke to force the creature out. But they also used practical tools. Bronze instruments and forceps were used to pull teeth. When magic failed, force provided immediate relief. The toothworm idea spread and lasted for centuries to India, China, Europe. In the Indus Valley, at the same time the pyramids rose in Egypt, people cared about the look of their teeth. This was early cosmetic dentistry. Archaeologists found attempts to adorn and replace teeth. Replacement teeth were made of animal bone or carved ivory. Fine threads tied loose teeth together for stability. In ancient Egypt, doctors and scribes wrote about the mouth on papyrus. Early medical books, like the Ebers Papyrus. They wrote about diseases of gums and teeth. Remedies were pastes and mouth rinses from herbs and minerals. Cleaning with small bronze tools. Securing loose teeth with gold wire. They couldn't fill cavities effectively, but they drained abscesses and stabilized teeth with wires. Their careful, observed work laid another stone on the long road to modern dentistry. As the great ancient empires fell, much of their organized medical knowledge was lost or scattered. During the Middle Ages, dentistry was the work of barbers, not doctors. The barber pole, red for blood, white for bandages. Barber-Surgeons had many jobs. They cut hair, they trimmed beards, they performed bloodletting. Most dramatically, they pulled teeth. They worked in bustling markets. They worked on street corners. It was public. It was quick. They used intimidating tools, often made by the local blacksmith. Heavy forceps and tongs, pelicans or keys, sharp implements for lancing abscesses, sometimes hammers and chisels. The barber surgeon gripped the tooth with a heavy iron tool and pulled. Assistants might hold the patient down. Some left feeling profound relief. Many returned with worse problems. Unsanitary tools caused terrible infections. Jaws were fractured. The wrong tooth was sometimes pulled. Yet this era wasn't without progress. Guilds formed, creating standards and sharing techniques. Barber-surgeons learned from constant practice and kept simple case records. Still, a toothache was terrifying, and its cure often as frightening. Pain was an accepted, unavoidable part of life, not the calm, quiet rooms we know today. The dawn of modern dentistry, Pierre Fauchard's revolution. Then in the 1700s, a new chapter began. The Age of Enlightenment was sweeping across Europe, bringing with it a new emphasis on science, reason, and order. In France, a man named Pierre Fauchard took this new spirit and applied it to the human mouth. He traveled throughout France, observing patients, treating patients, and meticulously documenting his findings. In 1728, Fauchard published a book that would change everything, and it was called Le Chirurgien Dentiste, or the Surgeon Dentist. It was a comprehensive 2-volume textbook that covered nearly every aspect of dental practice. He described the anatomy of the teeth and gums in great detail. He gave clear, step-by-step instructions on how to clean teeth, how to treat cavities, fillings with tin, fillings with lead foil. Fauchard showed how to make false teeth from carved blocks of ivory, animal bone, and even from human teeth. He described how to construct dental bridges, partial dentures, held in place with wires, held in place with silk threads. He even introduced methods for straightening teeth, using gold wires, using silk ligatures, inventing a basic form of orthodontics. He debunked the ancient myth of the toothworm. He correctly identified sugar as a major cause of tooth decay. After Fauchard, more practitioners began to think of themselves as specialized doctors, using better, more refined tools. They learned to make casts and molds, made neater, more durable fillings, and managed pain with greater finesse. The idea of a safe, calm, and painless dental clinic was still a long way off, but Fauchard had laid the essential foundation for it to be built. The industrial age revolutionized dental care, bringing steel drills, anesthetics, and the birth of dental x-rays. Machines made sharper, more precise, more consistent tools. The first drills were hand-cranked. A foot-pedal drill allowed dentists to control a spinning burr with their foot, freeing their hands. Steel drills could cut through enamel quickly, making cavity preparation much faster. At the same time, anesthesia arrived, the magic bullet that could finally conquer the pain. Horace Wells demonstrated nitrous oxide to prevent pain during extraction. Shortly after, William T.G. Morton successfully used ether for surgery. Dentists could now perform more complex, time-consuming jobs without torment. In 1895, Wilhelm Röntgen discovered the X-ray. C. Edmund Kells realized its potential for the teeth and jaw. Dentists could spot cavities between teeth, see the exact root length, find hidden abscesses, impacted teeth, and bone loss. X-rays made diagnosis precise and treatment plans clear. These 3 innovations, the high-speed drill, effective anesthesia, and diagnostic X-rays, formed the tripod of modern dentistry. Dental schools grew. Governments and associations established rules, licenses, and standards of care. By the turn of the 20th century, dentistry became the structured, science-based profession Fauchard envisioned. By the beginning of the 1900s, the look and feel of the dental office began to change dramatically. Germ theory transformed dentistry from a bloody trade into a clean medical practice. Dentists began boiling their tools in water and later using steam sterilizers called autoclaves. The simple act of washing hands and putting on rubber gloves was a profound change. The clinic became a sanctuary of health. Old fillings of lead and tin were replaced by silver amalgam and later gold. Mid-century brought tooth-colored composite resins. Researchers linked fluoride to strong teeth. Communities added fluoride to water, cutting cavities in children. Brushing and flossing became daily rituals. This era saw an explosion in specialization: orthodontics, periodontics, endodontics. Instead of pulling a deeply infected tooth, an endodontist could now save it. We learned the link between oral health and whole body health. The dentist became a key partner in long-term health. Today, a visit can feel like the future: tiny cameras, instant digital x-rays, 3D cone beam scans. Computer-aided design and manufacturing can deliver a custom crown in hours. Laser dentistry treats decay and gum disease and can whiten teeth with minimal sound and vibration. The primary goal of modern dentistry is prevention. From stone tools to steel drills, the story of dentistry mirrors human progress, innovation driven by pain, and compassion shaped by necessity. Think back on this long journey, the quiet hum of a modern clinic, tiny, precise drill, painless injection, digital image revealing every secret of the tooth. Each tool told a story, each patient taught a lesson. We are still learning every day, finding better ways to stop pain, regenerate tissue, prevent disease. Dental implants. A small titanium post fuses with bone, a replacement tooth that looks and functions like a natural one. The story of our teeth is not over, written in labs and clinics worldwide. Stones, steel, superstition, science. We move forward. The path was hard. It was slow, filled with strange fixes and bold minds, but step by step, with courage and curiosity, we learned to heal.